Today we are going to be discussing about the codes and conduct of laboratory personnel as to like what you should do and what you should not do. So late in the past years or days we have been learning what you should not do inside the laboratory or what should you do, but this time it's going to be a little bit different. We are going to discuss mainly on on how to deal with the patient or how to use your skills or how to be dedicated in your works and be more responsible. So let us see. So a medical laboratory technologies should observe and be bound by the following codes of professional conduct. So the first thing the first point mentioned here is like you have to be dedicated and to the use of medical laboratory sciences to benefit the mankind. You have to be very dedicated to your works. You have to be sincere. You have to be loyal to yourself as well as to the patients for the benefits of the mankind. And then secondly, like you have to exercise the professional that you have acquired during your masters or during your bachelors, so that and make use of that skill, and care to the best of their ability in a manner that it brings a good credit to the professions as well, either to the professions or to the department or to the hospitals that you are working in. So again we have actively seek to establish cooperative and specific working relationship with and other health professions. Like you have to establish a cooperative manner, like you have to be more in and be more specific in working relationship with the other health professions. As being a lab technologies, every now and then you are not only going to deal with the colleagues that is working inside your cabinet. You are going to deal with the other staff, other hospitals, like the nurse, the doctors, the therapists, or whoever it is working in the hospital. So you have to establish a very cooperative and a working relation with the other health professional as well. This is for the benefit of the others as well as for yourself. And also you have to you have to provide an expertise, advice and counsel other health professions. So like being a technologist, you cannot roughly advise a patient, or you cannot roughly consult a patient or any other person, any other layman person. Being a health professionalist, you have to be more expertise in giving the advice and in counseling the others. Now, you also have to maintain the confidentiality of the patient information gained in conduct of the profession, and not writtenly disclose results of information of a personal or confidential nature to the unauthorized person. Suppose like you are going to give a bad report or a sad report to a patient, so you have to be here in this case. You being a health profession, you have to be more, like you have to be more expert in counseling, or you have to be more expert in giving the advice, or else also you have to maintain the confidentiality of the patient, because everyone is not same. Even the patients are not same. Sometimes they might, even though the result is positive or negative, or whether it's good or bad, some people we have different mentality. So some people they want to keep their report as a confidential. That is why you have to respect your patient by maintaining their report or information, whatever, in a confidential manner. And also you should not disclose whatever the patient have shared with you. Every patient sharing should be confidential. Now you have to the next one, you have to safeguard the dignity and privacy of the patient. Again, the same thing. You have to you have to keep protected, you have to keep it safe, the dignity and the privacy of the patient. One patient come and tells you like, this is happening with me, this happened with that. That doesn't mean you have to go and share it with the other health professions or your colleague. You have to safeguard and the dignity and the privacy of the patient, and work like a professional health workers. So you also have to be responsible for the logical process, for the acquisition, for the specimen, to the production of data and the final report of the test result, and also be accountable for the quality and integrity of the medical laboratory services. Then maintain a responsible approach to community at large with respect to the handling and disposal of hazardous materials. Being a health profession doesn't mean you can dispose of your hazardous material just as anywhere you like it, or you cannot just go and dump in a place where you like it. You have to respect that community as well, and you have to be very careful in handling and disposal of this hazardous material, as it can be very injurious to the human health. You also have to conduct oneself in a manner to uphold and maintain the dignity and respect of the profession, and strive to maintain a reputation of honesty, integrity, and reliability. So this is very important. You have to be very honest, and you have to be very integrity and reliable. So why you have to be honest is that you cannot give a false result. You cannot give a false report to the patients by saying that just because you pity them. That is not the way. Being a health profession, that is not the way. What is truth? You have to be honest. You have to be with the we have to be honest with the report, so that whatever the report, it is bad or it is good, they take the precaution at the earliest, or they take care of themselves at the earliest. If you lie about the report, that is not going to be the benefit of the mankind and to the health profession as well. Now you have to strive to improve the professional skill and knowledge, and disseminate such knowledge to fellow members and person under their control, and also refrain from practices restricted by law, and not indulge in unfair or improper practice for personal or professional gain. This is very very important. Just because you have earned the degree doesn't mean that you can make use of your degree and then restrict the law, and then getting indulged in some improper practices for personal, or for the personal or like professional gain. Because there's so many cases like nowadays that people are making use of their profession for their own benefit, for their personal benefit. But being a health profession, you are to take care of the patient, you are to take care of the people. You are not to make you are you not to take not to sell your degree, not to make use of your degree for your personal gain, by practicing improper practices, or by practicing the restricted laws. So this is very important. You have to be like very honest and refrain from such practices. Now, one thing I want to tell about this laboratory codes and conduct is that, again, I want to talk something about on the personal protective equipment. So this personal protective equipment, it is like it is kind of a special equipment which you wear to create a barrier between you and the germs, or the microorganisms, or the viruses, as nowadays this PPE is very commonly talked about, which because of this ongoing pandemic. So I feel like you should know this personal protective equipment under the codes of conducts of medical laboratory though. So this personal protective equipment is very important, because it helps to prevent the spread of the germs, or the microorganisms, or the viruses in the hospital, since it creates a barrier between you and the deadly microorganisms or the viruses. So it protects the people, the healthcare workers, from the infection. So it is advised that all the hospital staff, patients, and visitors should use like this personal protective equipment when there will be a contact with the blood or any other bodily fluids. So I have given the sequence of this personal protective equipment. So this many people, or you might be thinking that you grab a personal protective equipment, so you can just wear it as like how you get dressed up on your own way, I don't know, but then that is not the way to, that is not the sequence of PPE. So we also do have a PPE sequence. We just don't wear it when we get it. So what are the how let us see how we should put on our PPE kit, and then how we should remove. So firstly, you have to perform the hand hygiene, the 7 steps of hand washing. Then you have to put on your shoe cover if it is applicable, if only if it is applicable. After that, you have to put on the gown, that is that is a mask. Then you have to put a mask or a respirator if required, that also. Then put on an eye protection, it can be of goggles. Then you put on the glove. That is how you put on the PPE, personal protective equipment. But once after you put on this, you have like you have collected the samples, of you have gone somewhere in the pandemic area or whatever it is, or in the hazardous environment. Once you come back, you are going to take off in this sequence again. You're going to remove your shoe covers if in case you have put on. Then you remove your gowns and gloves together. Then again you perform the hand hygiene washing, that 7 steps of hand washing. Then remove your eye protection, that is the goggle, and remove the mask or the respirator. Then again perform the hand hygiene, that is 7 steps of hand washing. After that, you can put on some a sanitizer or a moisturizer if applicable. So this is how you put on the PPE and how you take off the PPE. But remember that there is a sequence of PPE. You just don't simply wear the PPE like how you dress, like how you dress on your like your way. So there is a sequence of PPE, so please remember the sequence of the PPE. So this is all about the codes and conducts of the laboratory personnel.